Dr. Evan Chait, Kinetic Rehab and Spine. Welcome to our channel. Click the link below to subscribe, share, and like our videos. Join today, join the movement, gain access to insiders' education on how you become a better you. Welcome to your destination of health and wellness. All the best. Sempre Avante. Always forward. Hi, Dr. Evan Chait here from Kinetic Rehab and Spine. The next mobilization technique I want you to do is a T6, T7 mobilization technique. Now you're going to start with your legs crossed. From here, you want to get your chest up nice and tall. From this position, you can place your hands like this and you're going to reach up. The goal is this. You want to try to extend the elbows as you reach up. Now this is going to open up the mid-back at T6, T7. Now very important that you breathe from the nose. Inhale. Exhale. Inhale. Exhale. Now do that for about 6 to 10 breaths. You should stay in this position for about 30 to 60 seconds. Now initially when you start doing this, it's a challenge because most people's mid-back is restricted because of sitting for long periods of time. This is going to open up the mid-back. If you have any pain or problems into the shoulder, there's a couple of other exercises that I'd have you do before this to release your shoulder. But most of my patients have shoulder pain. Once I get their chest opened up, their pain goes away. Hopefully you enjoyed this video. All the best. Sempre Avante. Always forward.